What a great start to the session. Thank you so much, Abnasar. Guys, welcome to the 13th session. So excited to have everyone here. I feel like we have like the last people hanging on. I'm amazed at everyone showing up from all over the world. Please do continue to introduce yourself in the chat. Please continue to let us know where you're calling in from while we begin this series. Let me just quickly gosh, I don't know if I've ever presented using Google. Hannah WizKid, do you know how I can do this?
It looks like in the top right corner under slideshow, you can go straight from there. Yep.
Cool. All right, so please share your name, your country, your organization with us in the chat. We would love to hear from you. Why are you here today? Welcome to the 13th session of the Masterclass series. We are down to theme 7, systems change and leadership, lessons learned from the field and next steps. The series was co-curated by Nork and Ektan. It's part of our broader systems thinking initiative with the generous support of Porticus. We have 4 pillars in the work on systems research, systems investing, systems measurement, systems design and implementation, and the series is part of our systems measurement work. We're down to the last session, so hopefully most of you have already earned the certificate, but you have until May 17th to complete the short survey, to watch the video and respond, and we will be in touch with you for that. As always, after each session, you have access to all the recordings. Everything is on the website. Hannah, my colleague, will share the website on the chat. You can access the resources, the recordings, the PowerPoints, everything is there. And also, you can continue the conversation on ECD Connect as well. As always, the sessions have and welcome an introduction, the masterclass teaching by the systems expert, the dialogue with the early childhood expert, and the participant Q&A. Just as a reminder, please put questions in the Q&A, the chat. Make sure you select everyone if you're chatting, so it's not just the hosts and panelists. And for translation, we have our superstar Mitzi, I think she's a systems expert now, Mitzi. With big thanks to UNICEF LACRO for their generous support and providing the Spanish translation so we could make it accessible in Spanish as well. Muchísimas gracias. Bueno, so today we have an exciting session on measuring ECD systems change, systems level impact framework with Brittany Dernberger and our early childhood expert, Sharon Goldfeld. I'll introduce both of them in a second, but I just wanted to note, we've tried really hard to make sure we bring you perspectives, not just from the academic community. So we've had philanthropy, we've had donors, we have practitioners, we have independent consultants, and now like Brittany from a civil society organization. So and we've had policymakers on the call as well. So we're trying to take a 360-degree view of this. And then in half an hour, we're going to have the final session. I hope everybody joins with David Navarro, who is, a superstar world expert, the COVID-19 envoy to the UN Secretary General, a mentor on living systems leadership to many world leaders, and his partner, John Atkinson. So really looking forward to that session. So see you in half an hour there. In the meanwhile, it is my pleasure to introduce you to Brittany. She's a senior manager of systems level impact at CARE. Dr. Brittany Dernberger, she's a sociologist and gender inequality expert who has led research and organizational learning across academia, philanthropy, government, large international NGOs, and small nonprofits. Brittany currently leads global initiatives to measure systems level change at CARE and co-chairs the American Evaluation Association Systems and Evaluation Topical Interest Group. And along with her today, we have Sharon Goldfeld. She's the director of the Center of Community Child Health at the Royal Children's Hospital. She is a pediatrician, public health researcher, and policy advisor focusing on child development and health equity. She's the director of the Center of Community Health at the Royal Children's Hospital and team director for population health at the Murdoch Children's Research Institute. So we're really excited to have both of them. And with that, I hand it over to you, Brittany.
Thanks so much, Ikupe, and good morning, good afternoon, and good evening to all of you. It's such a pleasure to see in the chat where almost 200 of us are calling in from. I am really excited to share with you today how CARE has thought about measuring systems level impact. So our time together for the next 90 minutes includes the welcome, which we just did. I'm going to spend about 25 minutes talking about how CARE as an international NGO thinks about systems level change. And then I'll spend another 25 minutes or so talking in detail about our impact measurement framework to really think about how we assess that systems level change. And I want to end with really spending some time on the organizational learning component of this, because I know many of you sit in organizations or governments or different spaces where it's not only you wanting to make some of these shifts in the organization, it's bringing the organization along on that journey. And then we'll spend the final 30 minutes or so in conversation with Dr. Sharon Goldfeld and really thinking about how we apply this to the ECD context. So in all of my classes, I always like to ground our conversation in learning objectives. So by the time you leave class today or are watching the end of this recording, for those watching it later, I hope that you can apply a systems change lens to early child development and really be able to think about what is the system you're trying to change and the desired outcomes of that systems change. Second, really feel comfortable establishing the steps that you need to take to establish a systems level impact measurement framework for that systems change. And third, recognize at an organizational level how systems level impact measurement is different from traditional baseline endline program evaluations that many of us do in nonprofits and NGOs, and how we need to shift our organizational thinking about that evaluation. So I work for CARE, which is an international NGO that's been around for almost 80 years now. We operate in about 110 countries, so we have a pretty large footprint, and we do both humanitarian and development work. We focus on eradicating poverty, specifically around the unique needs of women and girls. So we have an explicit gender focus in the work we do. And as was mentioned in the introduction, I lead our systems level impact initiative there. So thinking about how we do systems change, but more so how we measure and evaluate the results of those systems level changes. And so that is the position I'm coming from. That's the context I'm coming from. And so I really look forward to our conversation, because I know systems level change looks different depending on where you sit and what your work is. So for us at CARE, as an international non-governmental organization or NGO, we're trying to make a pivot. And I would say CARE is not alone in this. I think this is a pivot that many INGOs are trying to make, to really move beyond just direct program delivery. Someone needs food assistance, you provide food. Someone needs access to shelter, you provide shelter. To really think about, how do we make systems change to address the underlying root cause why someone may need food or someone may need shelter? And by doing that, we're going to have a much wider impact. We also think about catalytic impact, which is where CARE or another NGO might start an intervention or a program, and then someone else, a government, a donor, another organization, really takes that intervention and runs with it and expands it. So I sometimes think of catalytic impact as, if you throw a rock into a pond, the initial intervention that CARE did is the rock, and that will have a certain effect and sink to the bottom. But those ripple effects, those waves that come out from that rock being thrown in the pond, are really the catalytic impact. So how is the work really expanding even beyond CARE's initial investment? And so this as an organization is something that we're thinking about how do we really expand our view of impact beyond that direct service delivery. And to do that systems impact, we have identified 6 pathways, as we call them, but they're strategies essentially of how we achieve systems level change. So CARE has a really strong advocacy and influencing history. So how at all levels of government are we influencing policies, programs, and budgets? Supporting social norms change because of CARE's explicit focus on gender. We do a lot of work on shifting social norms around gender equity. Supporting social movements. We know that in many, many places in the world, it's really grassroots organizations and social movements, advocating for and fighting for change. So how can we support those efforts? Service system strengthening and social accountability, which often looks like technical assistance to local governments or institutions or other entities. Do they have the right infrastructure around finances or human resources or content expertise? And then also the social accountability component is really how do we hold decision makers responsible? So for example, perhaps there's a policy in place, but it's not being implemented. So how do we really make sure that there's social accountability of our institutions? The 5th is inclusive market-based approaches. So how do we make sure that women and other marginalized groups are included in the private sector and other economic activities? And then finally, scaling up and adapting proven models. So when there's an intervention that works, how do we make sure it's simple, affordable, and cost-effective so that it can be replicated in other contexts? So this for CARE is how we think about making systems level change. And those are part of our strategic vision, what we call Vision 2030. So it's essentially our strategy through the year 2030. And within that strategy, we recognize that to achieve the change we want to see in the world, we need to work at 3 levels. We need to build agency, so really making sure individuals are empowered to make change in their own life. We need to change relations, which is really that social norms component, household level interventions. And finally, we need to transform structures. So how do we make sure that those underlying systems are operating in a way that leads to gender equity? So for us, systems level impact really focuses on those 2 domains of changing relations and transforming structures. So part of what this whole masterclass series is focused on is not only doing systems change, but how do we think about measuring it? So for CARE, we have 30 global indicators, which aligns nicely with Vision 2030, right? So that focus on 30. I am going to share the link to all 30 indicators so you can see them. I wanted to just share with you, though, the focus of the 3 framing indicators that map onto these 3 domains. So for agency, we measure the number and percent of women and girls and other marginalized groups who have increased their agency in ways that contribute to gender equality. So that can look like a lot of different things, but maybe they're, for example, participating in advocacy at the local level. 2 is relations, which we measure as the number and percent of people of all genders who experience more equitable gender and power relations, formal and informal. So again, this could look like a lot of different things. One example from an evaluation I was just working on is that girls and women in a particular community in Niger were able to travel to the health clinic without having their husband or another male relative accompany them, right? So norms are changing around girls and women being able to travel in their community publicly without necessarily needing a male relative to join them. 3rd is structures, the number of examples of transformed structures, formal and/or informal, for greater gender equality. So how are we changing policies? How are we shifting, perhaps social movements who are advocating for change? And then when possible, we try and trace how many people's lives are better as a result of those changes. And I'll talk more about this, but essentially, we can track the fact that a law passed in a particular country, The trickier part is how many people's lives are meaningfully better because that law is now implemented and functioning. And so that's part of what we try and think about when we measure our systems level impact. So again, these slides and all the links will be available, but here's the link for all 30 indicators if you want to look into more details. So for care, how we think about systems level change, and I keep saying for care because I recognize that this looks different depending on where you sit in the world and what organization you work for. So I'm really excited to get to talk more about this in the Q&A. But for us, when we think about systems level change, it's really altering those underlying structures that make the system operate in a particular way. And then we're particularly interested in when care or our partners are key contributors to that systems change. And we do that through working across those 6 pathways to impact at scale that I showed earlier. And we recognize that systems level change often happens at multiple levels. And that's part of what makes measurement tricky, is there might be changes, let's say social norms in a household that are shifting across the community. There might be changes at a local level around the local government doing something differently. There might be national or institutional level changes. So when we talk about the system, it might be operating simultaneously at multiple different levels. And then systems level impact, we measure as the improvement in people's life that resulted from that systems change. So to the extent we can quantify, we're interested in looking at how many people's lives are meaningfully better because that systems change happened. And we're particularly, again, focused on not just like direct program impact, but how many people's lives are better as a result of that systems level change. So when we work with our program teams internally, what we've been trying to do is to break this down into 3 steps. So if we're going to design for systems level change, we start by asking, what problem are we trying to solve? What are the structural barriers to that problem? 2, are we strategically using all those pathways to impact at scale? And then 3, how are we going to measure that? So let me go into each of these in a bit more detail. So the first one is really, what problem are you trying to solve? And let me talk you through an example from our Women's Voice in Leadership in Humanitarian Settings initiative, which is an effort to try and get grassroots women-led organizations more involved in humanitarian decision-making processes. So if I'm thinking about that example for this, the system we're seeking to change is really the humanitarian system at different national level. What aspects of the system are working today? I might think about, okay, well, humanitarian aid is getting into these places when needed, or perhaps, there are aspects that are functioning well. But what's not working with that humanitarian system is that it's really only big international NGOs like CARE who are participating, and these small grassroots women-led organizations that we really want to be lifting up and sharing capacity with are completely left out of that system and those decision-making processes. So therefore, we need to really think through how we influence both international humanitarian systems at like UN, United Nations levels, but also national level humanitarian systems. What would it look like for that system to work differently for people? Well, perhaps these women involved in these very grassroots social movement, civil society groups would get compensated for the humanitarian relief work they're doing, because right now it's pretty much all volunteer and they're just doing it, out of the goodness of their hearts. And how do these changes to systems impact people's lives? Well, often these women-led organizations are at what we think of as the last mile that other big organizations have a more difficult time to get to. So perhaps this would actually better serve communities because these local groups have different networks and different connections. That's just one example of it's applying this logic to thinking of what is the problem, and then what would it look like to really address that underlying issue or mechanism of that system. So in the interest of time, I'm not going to actually give us space to do this now, but what I hope you'll do on the side or after today's session is to apply this to your own work. So think through, what is the problem you are trying to solve? And ask yourself these same questions. And when I do this with workshops for our staff internally, I actually have people draw this as a picture, because it's sometimes really helpful to get outside of just like narrative word answers, but literally just give yourself a blank sheet of paper and draw this. Like, what is the system? Or if there's certain actors, you can make them bigger. If they have stronger relationships, you can do this like with a thicker line. Like, really get creative and artistic. And this is a great exercise to do by yourself, or maybe you want to take this back and share with colleagues. So this is one activity I encourage you to come back to after today's session. Step 2 is thinking about, how are we strategically using all the relevant strategies to make our desired systems level change? And again, this is going to depend on your context. So CARE's strategies, what we call our pathways to impact at scale, are these 6 strategies listed on the slide. These pathways are fluid. So sometimes folks will get a little bit caught up in like, oh, does this count as supporting social movements, or is it really service system strengthening? And it's often gray. These are not hard and fast boxes because they mutually reinforce each other. Sometimes advocacy is more effective if you have some institutional actors like CARE influencing alongside grassroots social movements, right? So it's often these strategies work hand in hand. And the other thing we've learned in our evaluations is that to be effective at making systems level change, you do not necessarily need to work on all 6 of these. In fact, I think that would probably be impossible in a lot of times. But what we have found is that successful interventions for CARE typically use at least 3 of these pathways. So that's what we're encouraging internally, is that you think about a combination of at least 3 of these strategies to make systems level change. But again, this is going to look different in your context. So I encourage you to think about, and you can even put it in the chat, what are some other strategies that might be most effective in your context? So we'll give people just like 30 seconds. Are there other pathways to change that you see happening that might be relevant in your context? And if you want everyone to see it, remember in the 2 box, you can list everyone. So these are, just as a reminder, these are CARE's pathways: advocacy and influencing, supporting social movements, social norms change, service system strengthening, market-based approaches, and scaling and adapt improving models. I see some great things coming in the chat. Data systems and data democratization is a huge need. That could be a pathway depending again on what is the problem you're trying to solve. Collaborating with other organizations completely. We know that often we do not do this work alone, right? It's really us working in combination with lots of other actors. Awareness raising, empowering staff, great. Making relations with communities, excellent. All right, so I am going to keep moving, but feel free to keep putting answers in the chat as you're reflecting on this, because again, depending on the problems you're trying to solve, you may have different strategies. And then finally, step 3 is, how are we going to measure that change and its subsequent impact on people? And this is often the tricky part, because we need a conceptual framework for capturing both that change that happened, but then also the impact of that change. And we need resources to evaluate that. And so that is what I want to transition us to next, is really thinking through how we measure this systems level impact. I wanted to share with you all CARE's journey in thinking about the framework that I'm going to walk you through. So this timeline is trying to depict about a 3-year journey from November 2021 to November 2024. I started at CARE in November 2021, so this is a bit oriented towards my own perspective, but I was hired by CARE to really build out this systems level impact measurement framework, to think about how we were going to try and wrap our arms around how do you put guidelines together that are applicable when we work in 110 different countries, which have very different contexts. So our journey was in fall 2021, we started planning some initial evaluations. And we did 4 initial studies that were published in October 2022. And these are public on our website. So it's included in the link on the website, and we'll make sure everyone has access to it. And those first 4 studies, we just wanted to understand how we were making systems level change in 4 contexts. So we looked at a humanitarian portfolio of our CARE Ecuador office, and then we looked at 3 other projects in Ethiopia, Nepal, and Uganda. And we used outcome harvesting methodology, which is a very participatory, qualitative approach to just understand, like, what was the change that happened. So we did that. It was a huge effort, worked with local consultants on the data collection. And as we finished that, our organizational leaders were like, this is great, but how many people's lives are better? Like, what's the impact number? And so then that led us to a phase 2 to really think about, okay, now that we understand like what the systems level changes were, how might we quantify that? Then during most of 2023, there was an opportunity that we really seized upon internally, where we were trying to measure the impact of CARE's contributions to COVID-19 vaccination. So how many people were able to get vaccinated against COVID-19 through CARE's programming and advocacy in 34 countries. And I'll talk more about this example later, but we did a lot of that analysis ourselves internally, which I think was really important to build our own organizational muscle and capacity to do our own measurement of systems level change. And then we also were working on a study with Village Savings and Loan Association, which are essentially like saving groups in Niger, that just came out a couple of weeks ago, and really focused on social norms change at a community level. And then we just kicked off 3 new studies where we're looking at 2 projects in Nepal, as well as a US government advocacy win, where we're trying to trace the impact all the way through. And I wanted to share this with you all because what I'm going to present as our framework today is really the result of our continued learning on each of these bubbles on this timeline. Every time we did an evaluation, we learned a lot. We got a little bit better at figuring out what questions we needed to ask. We got a little bit faster at doing it. So I encourage all of you, as you're thinking about your own organizational learning journey, to recognize this doesn't happen overnight, because for many of us, it's a different way of thinking about impact measurement. And especially if you're working at a large decentralized organization like I do, it takes time to bring people along on that journey. So we really did learn by doing. Like each evaluation, we got a little bit better. So for us, the key questions we now think about when we're going to do a systems level impact evaluation is, what is the system, or systems plural, depending on what you're looking at, that changed as a result of the win? And I use win as shorthand here because each milestone or win that we're evaluating looks a little bit different. Sometimes it's like an advocacy win, like a policy change that happened 2 or 3 years prior. Sometimes it's a shift in social norms that was really significant, right? It could be a lot of different things. So win is a shorthand basically for whatever it was that happened. How did the systems level changes happen? And what obstacles had to be addressed, or what notable tactics used, right? And you can see that a lot of these are very learning oriented. Like we want to know the answers to these because it can inform our future programming and future efforts. What was CARE's contribution to those systems level change, and what role did CARE play in supporting partners who contributed to the change? So this is something that comes up a lot. For CARE, we seek to measure contribution, not attribution. And what I mean by that is, especially when we're talking about systems level change, I mentioned this earlier, we are never working alone. We are one of many actors in a system. There are other organizations, there are other partners. And so it would frankly be really silly and embarrassing if CARE were to say like, oh, this is all because of CARE. We did this all alone. So that's not what we're trying to set up. Instead, what we're trying to say is, what meaningful role did CARE play? And do we have evidence that CARE played a meaningful role? Like, if this thing would have happened without CARE's involvement at all, probably then we didn't make a big contribution here. So we're seeking to assess our contribution, not to attribute the change in totality to our organization. 4, what were the outcomes of those systems level changes from the perspective of CARE and other systems actors? What were the changes that happened to the system and the people? So this is where you can see we're starting to make that logical leap from not just like what was the change at the systems level, but how is someone's life better because of that change? And then number 6 is about quantification, right? So how many people's lives are better because of CARE's contributions to those systems level changes? And number 6, not always possible to measure. There might not be enough data. There might just not be a way to quantify it in a way that we have resources to do. So I would say 6, we're not always able to do, but we try to measure how many people's lives are better when we can. So this is in very brief how we think about our systems level impact measurement framework. And I am indebted to Sandy Sue, who was a grad student who did her capstone project with me, helping us develop this measurement framework a little more than a year ago. And she was so great. We hired her as a consultant to help us continue thinking about it. So this is really relies on Sandy's master's thesis here. So most of our systems level impact studies to date have been retrospective, meaning we knew something great happened and we were looking backwards to try and measure that past impact. So our process for that is really developing a logic model. Now, this is important because I think individual projects often have a theory of change or a logic model. But what we have found is they're not at a systems level. They're really focused on that direct program intervention. So we often have to go back and work with the program team and really wrap our heads around like, what was the systems level change that happened here? We analyze each pathway. So that's those 6 pathways to impact at scale to say, what were the pathways that were relevant in this context? Often not all 6. We identify the changes and impact that occurred. We think about what are the indicators that we could use to measure that impact. And then we search relevant data sources. And I'll give you some examples of this later, but we often rely on public secondary data that we can find to really think through, like, are there ways we could estimate the impact using secondary data? And that's because as an NGO, we have limited resources for evaluation. So we really try and get creative about making do where we can. And then we gather the data and we analyze. Now, what we're trying to get better at doing is what's on the right side of this screen of designing for systems level change measurement from the start. And so this is, I would say, more of an ideal and something we're working on shifting to. And in those cases where we're designing from the start, we have a theory of change that includes systems level change within that. We're still looking at what are the different pathways this program will use to achieve that large scale impact. And then we start investigating, like, what do we think are the expected outcomes? Again, this is at the design phase, so it could change over time, but we think through what are some of those systems level outcomes, identify the possible changes and impact, identify the indicators to measure that impact, And ideally, we incorporate our Vision 2030 indicators, since those are our organizational indicators we always try and track. But there might be other indicators that are specific to a particular project or country, and then include those indicators in the monitoring and evaluation framework so that we're tracking them along the way. So this is ideally what we're trying to pivot to as we design programs going forward. So let me give you some examples of what this looks like. The first one I want to talk through is from one of the first systems level change evaluations we did of our humanitarian portfolio in Ecuador. And what this was looking at was going back a few years to 2020, where due to a lot of instability in Venezuela, thousands of migrants were crossing into Ecuador daily. And this was creating a lot of host tensions with the host community. And CARE focuses on gender. And so for this particular initiative, CARE was really trying to make sure that women, youth, and migrants who were LGBTQ had the protections and resources they needed. So what CARE Ecuador did was really influence the humanitarian system to better meet the needs of these target groups within the Venezuelan migrant community. So the bullet points here in the solution should look familiar as those pathways that CARE thinks about for impact at scale. So there was advocacy for legislative reform happening. There was working with the local health system to better train them on some of the unique needs of these migrant groups, shifting social norms about masculinities and migrants, engaging social movements. There were some social movements that were specifically focused on the unique needs of LGBTQ, which is lesbian, gay, bisexual, transgender, and queer migrants that were really involved, engaging other partners, etc. So the systems level change that happened was that host communities became more accepting of migrants through a result of all these efforts. Partner organizations and public institutions, including health centers and hospitals, delivered better quality services to migrants. And there were policies passed that specifically addressed the unique needs of women and LGBTQ migrants, for example, around gender-based violence. So then if you are an individual, how did your life get better? That is the population impact. So some of the examples of impact we saw were increased employment and entrepreneurship opportunities for migrants. Women reported increased self-esteem. We saw more people using health services, which is really important. And there was reduced gender-based violence. So you can see what we tried to do here is distinguish between what are the systems level changes, which are a little bit more qualitative, and then the population impact, which is really getting specific about how is someone's life better as a result of those systems changes. Now, this is where we're going to start getting in the weeds on indicators and measurements. So using that same example, I want to walk you through our logic of how we think about the impact. So we start with that pathway to systems level change. So it could be advocacy, social norms change, etc. We think about the systems level change outcome. And then CARE has a category of our data tracking that we call reach, which is essentially just like number of program participants. Like if we interacted with you in some way, we call that reach. Systems level change, so what happened at that structural level. And of that systems level change, we know that sometimes the impact is quantifiable. So 3 policies were passed that better meet the needs of migrants or whatever. And sometimes it's non-quantifiable. And then of that systems level change, we're interested in tracing that to the impact on someone's life. How is their life meaningfully better as a result of the systems level change? And within that impact, we know some of it is quantifiable. And for us, we're trying to align that to our Vision 2030 indicators when possible. And some of it is non-quantifiable. So let me give you a real world example from this Ecuador study. So in that evaluation, we found that there were 4 different pathways that the team had used. This particular one focuses on supporting social movements. So one of the systems level change outcomes that really emerged from the work partnering with social movements was that the rights of Venezuelan migrants and refugees were recognized by Ecuadorian and Colombian social movements and consortiums. So these consortia had said, like, hey, this is really important. We need to recognize the rights of these groups. So an example of reach would be the number of partner organizations trained to strengthen collective action. So for those of you who are evaluation people, that I would say is like a very typical output level indicator that you might track. How many organizations did we train to better support this group of people? An example of systems level change was that partner organizations have increased capacity to meet the unique needs of Venezuelan migrants. So they are operating more effectively. One way we might quantify that systems change is that 15 organizations are better connected and effectively meeting the needs. And I think that's really important because it's not just like, oh, 15 organizations are trained. It's that these 15 organizations are coordinating and talking to one another, and literally the support system is operating more effectively because these organizations are in contact with one another and working collaboratively. A non-quantifiable systems level change was reduced tension between host community and migrants. Now, you could, in theory, probably find a way to quantify that and measure it. For us, we didn't have the resources to do original data collection to say this is a very specific number related to how tensions between these groups reduced. The impact on people's lives resulting from that systems level change was that migrants are accessing needed health services. So one hypothetical example of how you might quantify that is, let's say 150,000 migrants received the social support they needed because they now know they have access to these health services. A non-quantifiable impact might be that migrants are empowered to know and claim their rights. I think getting to this point where we had this logic model was actually probably one of the most difficult aspects of coming up with this framework, because it really relies on multiple people in the organization. So like the program team, the evaluation team, etc., really being able to like think through these different aspects of qualitative and quantitative change at multiple levels. So you have, how is the change happening in this case at like the partner organization level, and then how is a Venezuelan migrant's life better in terms of the impact of that change. So taking the time to walk through this logic is really valuable in our experience. So just being really transparent about how we try and measure these pathways to change and our indicators is that we are still very much in our own learning journey around this. So 3 of the pathways are quite straightforward and map onto our Vision 2030 indicators. Social norms change and supporting social movements. We have a specific organizational indicator around shifts in informal structures. So it's a pretty clear place that we know we're going to track our systems level impact around those 2 pathways in this particular indicator. CARE has a long history of advocacy and measuring our advocacy impact. So we also have a pretty straightforward, well-tested way at this point where we track our advocacy impact around how many policies or influencing wins have happened, and to the extent possible, how many people's lives are better as a result of those advocacy wins. So these are like, okay, check mark, have that figured out. The 3 that are less straightforward are service system strengthening and inclusive market-based approaches, and scaling and adapting proven models. I have shared with you here on this slide the indicators that we tend to report the impact of these under. So for example, we track how many people of all genders are satisfied with their last engagement with service providers, and how many women have increased capability to participate equitably in economic activities. And the scaling proven models doesn't have its own indicator because, let's say it was like an education program that we were scaling, that would just get reported under our education indicators. But the challenge, which perhaps you were already thinking as you were listening to this, is that indicators 15 and 30 also include impact from projects that are just doing direct service implementation, just directly working with people in kind of a traditional NGO project program format that is not considered systems level change. So this is something that we're actively still working on. Conceptually, we have it figured out, but CARE is a huge decentralized NGO. I mentioned earlier, on a given year, we typically operate in about 110 countries. We have like 12,000 staff. And so trying to figure out how we disentangle how people are reporting under this impact in a way that's comprehensive across the entire organization is something we are still working on. We're actually launching something this July in our internal data system to try and flag projects that are systems level in a more comprehensive way. But I'm just being very transparent with you all in this space that we are still working on figuring out how to do this. The second example that I want to share around measurement is some example of some specific indicators from a systems level change we had in Nepal. And I'm sharing these examples specifically to remind us that systems change happens at multiple levels. And if you're interested in capturing that, you then need indicators at multiple levels. So in Nepal, our team there a number of years ago had done a lot of work around landless and women farmers. So these were people who were farming land, but didn't have technical ownership rights to the land they were farming. And that was a problem because you couldn't then get access to some of the government services for farmers. So our team there had done a bunch of advocacy, a bunch of work with social movements, a bunch of service system strengthening with local governments to pass the policy of a farmer ID card, which gave all of these landless farmers and other marginalized groups an ID card that identified them as a farmer and gave them access then to these government services for farmers. And so at an individual level, some of the indicators that we went back and tried to track as part of this systems level impact study were an increase in the number of marginalized farmers who now have access to farming related insurance, increase in the number of farmers who claim the insurance loss if they lost a crop or lost livestock, right? So not only do they have access to it, but are they using it? At a household level, we looked at, and these were not all the indicators we track, I'm just giving you all some examples. The household level, changes in the percent of households with food insecurity, the number of women farmers who participated in household level decision making. We looked at the community social norms. Again, CARE focuses on gender. So, for example, women farmers felt dignified and respected in the community. They had increased social status because they were invited to community spaces and social events where their voice was heard. Women were empowered to participate in key positions of committees there where they had some like specific basically civil society organizations for farmers that functioned a little bit like social movements. So women all of a sudden had, voting rights on these key committees. And then finally, at the government level, the way this policy was adopted was that it was like adopted in a few local governments, and then partly through CARE's influence, other local governments within the country also adopted this policy. So we looked at the number of government officials who have enhanced capacity on managing issues related to landless farmers and the farmer ID card. Community-based land management practices were implemented. And then we also tracked like how many local governments had adopted this particular policy. So I think this is just a reminder that we're interested in these impacts at multiple levels. How did we do this? If you're interested in impact at multiple levels, you need to also be creative of having data collection that's going to allow you to have data at multiple levels. So for this particular study, it was a combination. We had a household level survey that we were able to leverage that had been part of the end-line evaluation for the program itself that had resulted in the farmer ID card. We looked at publicly available secondary data. This is, as I mentioned, something we try and use a lot. So for example, DHS, which is Demographic and Health Surveys. There was the Nepal 2020 census. And so when possible, we try and say, okay, let's look at DHS data from 2016, before the farmer ID card was at all a part of the conversation. And then again in 2022, because the farmer ID card change happened in 2020. I'm making up some of these years, but try to do like before and after using secondary data. Making use of program data, often we have a lot of rich information in our program documents. So making sure we're utilizing internal baseline or endline evaluations, implementation documentation. And then this particular study, we used outcome harvesting to really gather the systems level outcomes that happened in a participatory way. So again, in the interest of time, I'm not going to give us time to do this, but these are the questions that I would encourage you to think about as you build or refine a systems level impact measurement framework for your own context. So I think this is helpful to do sequentially after activity 1 and activity 2. So you can go back after today's class and spend some more time on this. But I would think through, what are the systems level change outcomes that you might expect to happen? And again, you might have some that are quantifiable and some that are non-quantifiable. What would be the impact on people's lives, quantifiable and non-quantifiable? And what organizational indicators might you want to incorporate? So are there other key indicators, outcomes, et cetera, that as an organization you all track that you could incorporate in your systems level impact measurement framework? So just take some time after today's class to come back to this, because I think walking through that logic is going to be really useful as you refine your own measurement strategy. The third example I wanted to end with from the impact measurement perspective is the evaluation I mentioned that we did around CARE's contribution to COVID-19 vaccination. And this is the one where we really built our internal muscle. And the point I wanted to make with this example was the importance of triangulation of multiple data sources. I alluded to this on that Nepal example of how we used a combination of data sources. But for this particular evaluation, we did our own country case studies, where for each of the 34 countries that we were included in this evaluation, we reviewed program data, we talked to the program team there, we did a mini assessment, basically a mini case study of what CARE had done related to programming and advocacy around COVID vaccinations in that country. And then we used that to determine whether CARE had made a meaningful contribution. So 29 of the 34 countries met our threshold for evidence to say, like, yes, we had a meaningful contribution here. And then we took those 29 and used secondary data, so publicly available secondary data from like the World Health Organization and some other sources to look at how many vaccinations had been delivered in those countries, what proportion of people in the communities where CARE worked were vaccinated. I can get into the weeds if people are interested, but basically we did all of these calculations to try and estimate CARE's contributions to vaccine impact in those countries. We did all of that ourselves internally, and then we hired an external evaluator to do bellwether interviews to assess CARE's contribution to getting the US to donate vaccines to the countries who needed them. And it was really through all of these different sources that we landed at, like, here's the specific number that we think CARE contributed to. And the external piece is really important. We had done some initial calculations ourselves, and then when we got the results back from the external evaluator, we actually revised our numbers down significantly. As my colleague likes to say, it's one thing to say that your own children are cute. Of course you think they're cute, they're your kids, but you need someone else to say, yes, your children are beautiful, in order to really have that external validation. And so since we did do a lot of the analysis ourselves internally, I think having one leg of the stool be from an external evaluator was really critical to this evaluation having credibility outside of CARE. So we really got to the end result of this evaluation through these multiple data sources, which I think, because systems change is complicated, is often the reality if you're doing a really wide scale systems evaluation like this, which was looking across 34 countries. So in our final few moments here before we open it up to discussion, you've heard me hint at this throughout our conversation, but I wanted to specifically say there are important elements of thinking about systems level impact differently than our traditional internal evaluation for organizations. So I put together these 3 tips. This is something that we keep in mind when we're hiring external consultants to support us in doing systems level change evaluations. First is that this is not a traditional end-line program evaluation. And one of the things we've learned is that if you treat it like a traditional end-line program evaluation and just try and like add in some systems level change questions, we have not gotten the results that meet our expectations for robustness. So it's really about, for us, we have found we need to work in close partnership with our external evaluators and have like regular conversations about methods, data availability, making sure they're actually assessing the systems level change outcomes. And that you can't just like hire a consultant and send them off in the way you might kind of a very traditional baseline or end-line program evaluation. One of our big challenges internally is that project meal, so monitoring and evaluation and learning budgets, are often tied to the duration of a specific project. And systems level change wins often span multiple projects, and they often take multiple years, and you can't see the impact of the systems level change often for 2 or 3 years after a project has ended. So one of my big internal advocacy efforts has been trying to get the organization to allocate funds for systems level impact evaluations outside of project budgets, because our project budgets just are not the right timeline for systems level evaluations. Second, it's really helpful to include comparison groups in your methodology if possible. If you work somewhere like I do, where you're working in humanitarian and development context, this is not always possible, but I put some examples here of some studies where we've been able to include a comparison group in the evaluation design. So for example, we did some focus groups in the Niger study with communities who do not have the savings group versus those that do. And it's not a full experiment, but it's a nice way to really try and get clear about, are some of the systems level impacts we're seeing because of a specific intervention. And then finally, as I just mentioned, the triangulation of multiple data sources we have found is really critical to establish systems level findings. So when we hire an external consultant at this point, right, if you think back to that first slide, we've learned a lot from the number of evaluations that we've done. But when we bring on an external consultant, this is essentially the scope of work we're asking them to do. We're asking them to establish CARE's contribution. Were we a part meaningfully of this systems level change? If not, then we really don't need to go any farther, because the first thing we need to do is make sure that CARE actually meaningfully contributed. Refine the theory of change to really focus at that systems level. And then map out the qualitative and quantitative impacts. So qualitatively, like how and why did the change happen? Quantitatively, how many people's lives are better as a result of those systems level change? Triangulating multiple sources of data. And then throughout, we're really focused on learning and recommendations, because we're iteratively trying to get better and better at this with each evaluation. So with that, we are amazingly, I think, right on time. So I am going to invite Dr. Sharon Goldfeld to join us for a conversation.
Thank you so much, Brittany. If you wouldn't mind stop sharing, I think it'd probably be easier for the audience to see us both, which is fantastic. So first of all, thank you so much. You can see all the little emoji clapping hands coming up there. So that was just a terrific presentation around evaluation that I think everybody really enjoyed. And can I just say, and I could see from some of the questions coming through and the bits in the chat, is that I think it's kind of almost an evaluation support group that you've got lying here, which, because, you know, everybody's grappling with these sorts of issues. It's not like, you know, we've all sat here and gone, well, we've got it all sorted. What are you doing? But actually everybody's grappling with some of these issues, with all of us trying to work out two tensions that I think are very relevant to early childhood development, which, if I can just segue just a moment, one of our challenges in early childhood development, which goes to some of the challenges you spoke about, is that early childhood development is not a program evaluation. And we get this sometimes, this conflation between early childhood care and education, which kind of is a program, and it's where the SDGs are kind of hooked in. But actually underneath the SDGs is actually early childhood development as an outcome. And when you have a look at early childhood development as an outcome, it's no longer just a program evaluation. It's really about all the things, everything from the small micro system, which is the family, right through to those macro system changes that all need to come together to actually change this really important outcome that we all value, which is these early childhood development outcomes, both on average, but more importantly, maybe the inequity that we see in early childhood development outcomes, which we have not shifted substantially, even though 2030 is looming quite, looming large. And so there is this, I think, this increasing momentum. I think there's an increasing anxiety amongst those of us who work in the ECD that we're not getting there quick enough, that there are years upon years of children being born on this planet where we're seeing the early years being squandered, and that human capital being squandered. So I was really appreciative of your focus on human outcomes as the sort of thing that we really, really want to see. So when I'm reflecting on that, I'm sort of thinking about what are the sorts of things that we can do that will both tell us what might be useful levers for change, and therefore that's the evaluation framework, but also what can we do on a daily, weekly, monthly basis that's actually moving the system as well. So there's the kind of arm's length evaluation. I think this was your tension that you outed between the retrospective evaluation, you know, we came and we saw what happened, versus the prospective evaluation. And I would argue, and maybe this is for conversation, the opportunity to be both evaluator and disruptor. And that's a tension, right? Because evaluator, hang on, we're not a disruptor, but I would argue that we probably do need to be a disruptor. And I'd really like a discussion. And I sort of said to Brittany, one of my great passions is indicators and the use of indicators to drive change. So we might geek out a bit on indicators. And I saw through some of the questions, there's some other fellow geeks online. But the idea between lead and lag indicators and how we might be able to use lead indicators where we're actually changing the system as we go. So we're course correcting as opposed to getting to the end and go, well, that didn't work. Or we get to the end and go, that did work, but how do we actually kind of scale that in a way that puts power in the hands of people who can scale? So I think in ECD, that's where we're really struggling is, you know, how do we do this stuff? How do we do it faster? And I always feel a bit heretical when I say faster because people always say, well, you know, system change is slow. And I go, well, tell that to a 2-year-old. You know, that's not to me acceptable. We need to be able to go faster. And we know there are plenty of systems, you know, that go faster. Have a look at what's happening in social media, have a look at what's happening in businesses. They all go faster. So how do we learn from that? And how do we do that for ECD? So my first question to you, which is, you know, after my little sort of soapbox moment, my first question to you, Brittany, is on reflection of all the things that you've done, and I know they're related to early childhood development. What do you think are the sort of applications of your thinking to early childhood development? And in particular, some of the tensions that you feel as an evaluator sitting within an NGO, where you've got some levers for change, but many of them will sit in the government versus the non-government sector. What do you think are some of the things that you've learned that the people online here could really take away that's specific to ECD?
Yeah, thanks, Sharon. Those were really insightful reflections. So, well, two things, I guess I would say. One is using that systems lens for program design at the beginning. I think probably the ECD world is similar to some of the spaces I sit, where it's so easy to be like, oh, this donor has put out a call for this thing. Like, let's write a very specific grant proposal for this, like, one little narrow thing. And it's very easy to all of a sudden have this kaleidoscope of projects and programs that are all individually doing fine work, but they're not comprehensively investing that system, in that systems change. So to the extent that we can all pause and take a step back and say, and really draw that picture, like draw the picture of the system you're trying to change, because you're still going to write proposals and seek out opportunities, but you'll, I think, be doing it with more clarity on like, this project is this corner of our theory of change, of how we're going to change the system. And this project is working on this lever of how we're going to change the system. And so having that underlying logic, I think, is really critical. The second thing that I didn't mention that we have learned that is in some ways daunts me, but I also think is an important learning, is that so much of our really impactful systems change was not planned. It did not, someone did not sit at the beginning of the project and say, we're going to make this systems change. It came about organically and iteratively as people were responding to dynamic contextual factors. So one example, it came from our Ethiopia evaluation, was like Care Ethiopia had spent years and years building relationships with some of the government ministries, to the point that when anything gender related came up, the first phone call they made was to people at Care. That is like a really, phenomenal, huge influential relationship to have with a government, especially in some of the places where we work. I don't think anyone set out and said, okay, over the course of 10 years, we're going to build this really meaningful relationship with government officials. And so to me, I think in terms of the ECD work, it's both having your clear picture, your clear theory of how you're going to shift the systems, but also creating enough time to give ourselves space to respond to these strategic opportunities when they emerge, because systems are dynamic. And so how do we make sure we're not so bogged down in our daily work that we aren't able to take time to really pivot as opportunities come up?
And I wonder if we can then, because I think your point about the relationships, I don't think there's a person that has presented in the last 13 of these presentations that hasn't highlighted the importance of relationships. And I think we all know that the relationships are so important. And that's one of the challenges in this systems work, is the technical and the non-technical aspects that are needed, and in the importance of sort of staying there, the persistence, the patience that are needed to develop these relationships over time. So I don't think any of us would discount the importance of those relationships, because that's what we've all found, and those people on the line here have absolutely been those sorts of people that have stayed there and built those relationships. But I want to just talk about this idea of lead and lag indicators for a moment, because it's actually come up as part of the questions as well in the Q&A, about the idea of lead indicators that can be, and it's sort of related to the improvement work that you see through the Institute of Health Improvement, that has come through improvement science. And this is part of the work that we've been doing as well, and it's related to the democratization of data, to be 100% honest. And it's my belief, but I think it'd be great to get your ideas about this as well, is that if we can put data in the hands of the people who can change the system and truly democratize it, which includes having the right indicators, the right data capability, and the right, not just data capability, but capability of actually knowing what to do tomorrow that's different to today. So those microsystem changes, that's kind of the disruptor and maybe the accelerator for systems change. And I wondered whether, because your 30 indicators are pretty much lag indicators. When I've had a look at them, there's not much in the lead indicator space. And I just wondered what your thoughts were about, do we need better lead indicators where we've got a clear sense of here are the things that we could do, that we could change tomorrow, put it in the hands of those people who can change the system, and then get them measuring it that we're not always stuck with, well, we don't have the data and no one's measuring this. So I just thought I'd reflect that back to you, because I'm very interested in this lead and lag indicators as kind of part of a holistic approach to data and indicators and systems change.
Yeah, thanks, Sharon. So I 100% agree. We need both lead and lag indicators. And I will say at CARE, we have not figured this out yet. As you rightly said, most of our impact indicators are lagging indicators. And I mentioned this, but just to re-emphasize, specifically for things like advocacy systems level change, in many of the places where we work, even if a policy passes today, by the time it is budgeted and implemented and a woman in Malawi actually feels like the meaningful change in her life as a result of that policy change, is like 2 to 3 years before there's enough information where we could go and reasonably estimate the impact. So that's really hard, because it's like great learning to look back retrospectively, but it's a huge time lag. And so we are trying to get better at these leading indicators, but we have not figured it out yet. So just as some examples of CARE is getting ready to do a big push on frontline health workers. This is one of our new initiatives. And so I've been working with that team to apply some of our lessons learned and say, let's build in some systems level change, indicators and outcomes from the beginning. But we were just having this conversation of like, okay, these are great, but how do we make sure that we're not 2 years down the road before we realize something is not working? And so we've been trying to think through things like, okay, well, one of the big outcomes is our frontline health workers, who 70% of frontline health workers globally are women, and they're often unpaid. They're like volunteers in their community. So if one of the goals is that they get paid, what might be a leading indicator of that? Okay, is there conversation around it at local or national governments that we could be tracking? Are there at least policy changes getting passed? So all that to say, maybe people on this call have ideas. We have not figured out a way that is not onerous, because I think the other strategies we've tried in the past rely on program team members who are already stretched very thin implementing programs and very busy to try and like produce data more often so that we can be analyzing it more quickly, and we just have not figured out how to do it yet.
I think, Brittany, this is exactly the conversation that I think we all should be having, because I think it's this difference between we're evaluating and can you give us some data for evaluation versus powering up the frontline workers so they want the data because they're going to use the data to actually change what they're doing and course correcting. And even around, we've been playing with this triple bottom line, particularly around services, which I know are not the be all and end all, but around I would call the triple bottom line, only because it's useful to say triple bottom line of quantity. Is there enough of this to actually service the population? Quality, is it any good? And can we measure that? Is it any good in a way that makes sense to that service and that service provider? And participation, are people actually coming? Because you can set up great things that nobody comes to, and measure those things and measure them often, because the policy levers to answer any of those actually quite different. Not having enough, not any good, or participation are quite different. And also the response mechanisms are very different. So you can change participation on a weekly basis. If I'm setting up for example, if I'm setting up an early childhood, even if you do it in early childhood education and care, if I'm trying to get 100% of the population to come to something, I know what the denominator is, I know what the numerator is, people are coming. What happens in one place might be very different to another. For example, like the Sudanese refugee families are not coming in one area is a different problem to solve to the marginalized population somewhere else, who are living in caravans, because that's quite different. So you've got these different problems. And I think I'm always very mindful of trying not to macro solve things when actually we probably need to micro solve. And so these are these lead indicators versus lag indicators. And these are the disruptors that are possible. And is that the sort of thinking you guys have been doing in care? And what do you think about that as well? Maybe that's the wrong triple bottom line.
No, I think that triple line makes a lot of sense. I recognizing this is recorded and here people are on the line. But I honestly don't think we're that sophisticated yet. I think we are so bogged down in just the daily, like, donor required data management and like basic data infrastructure. I think what you just described, there's a lot of desire for, but I feel like we are so far away from being able in real time to say, what are we seeing here? How are we analyzing that and interpreting it? One of the moves we just made last year at a global level is for our internal data system where we track these 30 indicators. We cut 30% of our data fields, which was this huge political internal effort to say, like, are we really using the data that comes in from this? If not, we're cutting it. Because what we found is your exact point of, like, we were spending so much time just collecting the data and cleaning it, not even really analyzing it in a high synthesis level way, not learning from it, but just like bare level of data quality. All of our efforts were going there. So we did this partly to say, let's shrink down how much information we're collecting with this explicit purpose in mind, that it's going to give us more time to make sense of the data, learn from it, use it. And so for us, because we are a huge NGO, that means we now can release impact data twice a year instead of once a year. And that may seem like a really small change, like, oh, now it's 6 months instead of 12 months, but it's part of our desire to try and like get quicker at this. So I would say we are so, because what you're describing to me is much more real time. Like, here are attendance numbers last week or last month, and then how do we pivot accordingly? And I think we're still unfortunately quite far from that, but this need comes up all the time. So I think it would be great if we could find out a way to do it that was feasible, and not super onerous.
And I think we probably underestimate the ability for digital solutions for some of this in a way that makes sense. And I know that many of the countries you're working in are low resource settings, but I just think the ability. We talked about this at another session, and I know Johnny's on as well, about this kind of transformation era that we're in at the moment, where there's just rapid transformation happening through our digital platforms, our ability to do AI. And the question is, how do we harness all of that so we actually do good, as opposed to let it all happen to us and then go, holy crap, now we've got bigger inequities than ever, which is actually where we could head. Brittany, there are a number of questions online, and some one of the themes that has come through is some of the challenges actually at the impact end. So there's a few questions on that, which is, how do you choose your impact outcomes? And in particular, how do you manage the tension between secondary data that's just available and let's pick the best one we can, versus actually these are specific outcomes we want. How are we going to go about getting them? Because I think then there's quite a bit in the chat about this tension between outcomes and impact indicators, etc. But maybe, and then maybe a chaser to that, which is also one of the questions, which is, and if you're a small organisation, how do you think about those things as well? Because not everybody's going to have the resourcing. So how do you really strategically think about what are those impact indicators? What compromises are they making? And then what are the sorts of things we could do to actually measure them?
Yeah, great questions. So I will say that my role internally is like learning, evaluation, impact measurement. So if it were up to me and I was in charge, we would dedicate a good amount of funding annually to this kind of learning and evaluation. The reality is we are an NGO, right? We don't have unlimited resources. And so it's a lot of, and I think this tension is real no matter what organization or government entity you work for, around there are only so many dollars, and you want to invest in the programming and the work, and you've got to keep the lights on. And so I say all that to say, I recognize these resource conversations are very real. So because we are so decentralized, and I'll try and say this in a way that doesn't get too much into like care operational structures, our country offices have a lot of autonomy around their own strategic portfolio that they're working on. So they may have some outcomes or specific indicators that they're really interested in measuring at a country office level. We also sometimes have certain donors who require the measurement of certain outcomes or impact areas, which I'm sure many of us are on the call with. And then you have people like me who sit on global teams who say, hey, we have these 30 global indicators, make sure you're measuring these. So it's a bit of a persuasive art for the actual person putting together like a meal framework for a proposal to try and thread that needle. So I will say it's a bit more of an art than a science. From where I sit, if we could be focused on the 30 global indicators, I think that would be ideal. But the reality for our country teams is they're often trying to also appease the interest of several other invested stakeholders. I think as we get better at systems level impact measurement, we are trying to do a better job of getting really like specific on outcomes versus impact. What does that mean? How do we think about the qualitative like systems level outcome and then the impact that would be in someone's life? I think we're still at our own like very baby step stages of trying to do that comprehensively across the board. So for small organizations, and perhaps this also applies to any size entity, I would say start small. Like if you can have 2 or 3 systems level change outcomes that you are tracking, amazing. One of the things I've been advocating for internally is like, we're going to completely overwhelm ourselves if we try and do it all. So if we can strategically invest in like one good systems level impact evaluation per region each year, for example, that would be already so much more than what we're doing right now. So I would say pick just, 2 or 3 outcomes or impact areas to focus on to start. And then just to briefly answer the secondary data piece, this is, again, it's a money question, because if we had all the money in the world, I would love for us to be doing original data collection to specifically answer the question we're asking around like who's impacted and in what way. We honestly can't afford that most of the time. So it's often more of a scrappiness of just like, well, we don't have the resources for that, but let's see if there's some secondary data where we could estimate. And I think this ties back, Sharon, to like the real-time data, AI related conversations of I think we do a disservice sometimes where we say we need original data collection for every single thing, because CARE is one NGO of many, right? So then where some of these communities are completely like bombarded time after time with surveys and focus groups, etc. So is it perhaps more equitable to rely on secondary data that already exists versus continuing to try and harvest information from the same communities, and it's lower resource intensive for everyone? So it's a trade-off though, because then sometimes you don't get the exact piece of information you want. So those are some of the things we weigh as we think about it.
I think you're absolutely right. And I think one of the earlier presentations that we had in this, which was trying to think about some of the decisions we make in evaluations that are kind of really about the ethics, which is, what are we measuring, what's in and what's out, and how do you put boundaries around that? Because actually what you're saying is we can't do everything. So now we have to make decisions about what's in and what's out. And the other thing, and this has come through the chat a little bit, is we also need to be mindful that change is not necessarily improvement, that there are harms as well as benefits. And how do we make sure that we don't do the don't sort of succumb to the, well, if we do something that's better than nothing, because sometimes it's not better than nothing. And I wonder if you might reflect on that in the work that you've been doing, and how, because you're obviously CARE is a single NGO, but to your point, you work with many other NGOs. And so how do you manage that sort of ethics between what CARE is doing, what other NGOs might be doing in a particular area, how you work together to get a collective systems change approach, and how do you course correct so that you're not actually accidentally doing harm, or actually, and I've talked about this previously, I think we have to be careful that no impact is harm as well, because it means the resourcing is not being used for something else. It's a bit of an esoteric question, but I think it's important in the evaluation field to think about these things.
One of my dreams that we have not been able to make happen yet is that care does not do systems level impact evaluations alone. Like if we're often doing this work in partnership with other organizations, let's all collectively invest in doing a true systems level study where care is one of many actors, because yeah, the esoteric part is a little bit of care has donors who want to see that care is doing good work. And so there is a self-interest from the organization of trying to be like, look how great we are. But if every organization is doing that, there ends up being this competitiveness despite everyone having similar goals of systems change. So I would love to see more of a consortium approach to systems level impact studies. We've experimented with this a little bit in the Latin American region. We have a tool that we use to measure our advocacy impact specifically that feeds into some of our systems level change efforts. And so CARE filled out our own tool, but we had gotten a request from partners like, hey, can we use that tool to measure our advocacy impact? So we adapted it and just made it a bit more generic, less specific to CARE. And then they use that to kind of showcase their own role in the advocacy impact. So it's to me, it seems so possible. It just, I think, requires some coordination and some communication and willingness to be like, this doesn't have to be all about us as an organization. And then the piece I would say on recognizing that not all changes are positive, that to me is the importance of asking really open-ended questions in the evaluation, recognizing that change is not linear and change is not always positive. So what are some of the unintended impacts, good or bad, right? Intended or unintended, and trying to capture those, because that's definitely part of the story.
Brittany, thank you so much. Shikufe, I think I've tried to capture some of the questions. Is there any other killer question that you think I've missed out on in the final moments of this amazing seminar?
Even if there is, we can't get to it because we only have 2 minutes left, and I need to just complete the sharing of.
I think we covered most of the. I mean, I have not specifically, but I think I covered most of the issue.
Yeah. So let me. Yeah, I think that was great. Sharon, you did a fantastic job as always. Masterful, truly. All right, guys, in terms of next steps, you know, don't forget to complete the survey, and colleagues are sharing that in the chat if you're interested. I mean, we're interested in your thoughts regardless of whether you're interested in the certificate or not, so please share that. And finally, in half an hour, it's the session 14, last and final session, and we hope to see everyone there. And we're exploring systems leadership. How can we take all of this work forward? So thank you again to Brittany and Sharon. You will have access to the recording and everything Brittany has shared on the website. Of course, Palix Foundation is offering a masterclass as well for colleagues, specifically for the masterclass colleagues on Thursday, May 23rd. More resources on systems thinking you can find on our website. Continue the conversation at ECD Connect. Huge thank you to the ECDAN team for all their big efforts. So with that, I think we have a minute. Yes, looking forward to the next last session. Thank you again, Brittany and Sharon, for that really riveting, engaging conversation. And thanks, everybody. We will see you in half an hour.
Thank you so much.
Thanks, everybody.
Great session. Lots of, this is incredibly thought-provoking. A lot of great feedback, Brittany and Sharon. So I think people have really enjoyed this. Thank you.
And can I say there were a lot of great questions on the Q&A, and actually thematically they, as I said, I tried to bunch them, but they actually were quite thematic. So the Q&A I think ends up on the website as well. Is that right, Shikufe?
I think not. I think that's one thing we actually cannot. Zoom doesn't allow us to download that.
Oh,
so
really? Just such great. They were really great. I don't know if you can copy and paste them somewhere, but yeah,